You know, when we hear the word addiction, it's easy to think it's something that happens to, well, other people, right? But the truth is, it can affect absolutely anyone. And what's really interesting and kind of scary is that sometimes the very job we do, or even just the stage of life we're in, can create these hidden risks we just don't talk about enough.
So let me ask you this. Does your job affect your health? And I mean, yeah, of course, we all think about the obvious stuff. Back pain from sitting all day, or maybe eye strain from staring at a screen. But what if the impact is way, way deeper than that?
Yeah, for a whole lot of people, their job is more than just a paycheck. It's actually a huge factor in their struggle with substance use, and it's a struggle that's almost always happening in silence. So let's dive in and really try to understand why. Okay, so here's what we're going to cover. We'll start with the hidden side of work, then look at some really high-stress professions and high-pressure careers. We'll also talk about specific environments that create risk, and wrap up with why getting the right kind of support is just so important. All right, Section 1, the hidden side of work. The big question is, how does a job, something that's supposed to support you, actually become a risk factor? Well, it happens when the demands, the culture, or just the day-to-day environment of your work starts piling on pressure. Pressure that can push people to cope in some really unhealthy ways. And there's actually a term for this, occupational addiction. Now, it's not some formal medical diagnosis you'd find in a textbook, but it's a really powerful concept for understanding why some jobs come with higher risks. It's all about that deep connection between what you do for a living and how you're actually living your life. So, let's get into some specifics. We'll start with those high-stress professions. I'm talking about the folks on the front lines. The jobs where people are dealing with intense, often traumatic, life-or-death situations every single day. First up, nurses. Just think about what they do. They're on the front lines of care, surrounded by immense suffering, yet they have to provide compassion, all while working these long, absolutely grueling hours and making split-second decisions that could save a life. And then you've got police officers. They are constantly, and I mean constantly, exposed to danger and trauma. And through all of it, they're expected to be the calm, controlled presence, no matter what chaos is unfolding around them. Okay, so what do these jobs have in common? Well, you can see the shared challenges right here. High emotional stress? Check. Exposure to trauma? Absolutely. Long, irregular, just brutal hours. But look at that last one. A culture of stoicism. This one is huge. It's this unspoken rule that you have to tough it out. You have to be strong. And that makes asking for help feel like you're failing, like you're weak. Imagine, your whole job is being the helper, the protector, admitting you're the one who needs help? That can feel impossible. It's a really dangerous mindset to be in. Okay, let's shift gears a bit. Because it's not always about physical danger or frontline trauma. Some of the riskiest jobs are the ones defined by this relentless, crushing weight of expectation. So let's look at a few examples. You've got executives and bankers. For them, it's the constant 24/7 demand to perform. Your entire worth feels tied to the last quarter's numbers. Then there are lawyers. Their entire world is adversarial. It's high-stakes conflict, day in and day out. And what about teachers? They have this incredible responsibility for our kids' futures, but so often they're dealing with a lack of resources and support. See? Totally different fields, but they all share that same intense pressure to deliver. All right, so beyond the stress of the job itself, sometimes the environment is the biggest risk factor. The actual physical and social setting can completely shape a person's struggle. Let's take a look at a few of these. Construction workers, for instance. The job is incredibly physically demanding, and a risk of injury is super high. So what happens? A legit prescription for pain meds can slowly turn into a dependency, just to make it through the day. And then there's college students. Okay, not a job, but definitely a high-pressure life stage. You go from the structure of home to complete freedom, all while dealing with insane academic and social pressure. It's a perfect storm. And finally, truck drivers. For them, the risk isn't chaos, it's the opposite. Total isolation. Just miles and miles of road. That deep loneliness and monotony can become a huge psychological burden, and some might turn to substances to cope, or even just to stay awake. So you can see, we're talking about all these different people, with completely different pressures and environments. It becomes pretty obvious that a one-size-fits-all solution for getting help, it's just not going to cut it. The path to recovery has to be tailored to the person's actual life. And you know, one of the biggest hurdles is just waiting. People think, I'll get help when things calm down, or I'll wait for a more convenient time. But let's be real, for a busy professional, a parent, a student, that perfect moment just never comes. And all that waiting just makes the struggle worse. And that's really the heart of the problem, isn't it? Most people can't just press pause on their entire life. You can't pause your career, your family, your mortgage, your education. So the thought of just dropping everything for a 30 or 60-day inpatient program, it feels completely impossible. It's overwhelming. This is exactly why flexible options are such a game changer. Things like outpatient programs. They let people get the serious help they need, but they can do it while staying at home, keeping up with work, and staying connected to their family. And maybe most importantly, they get to practice their new coping skills in the real world, in real time.
So, flexibility is one piece of the puzzle. The other is personalization. Care has to be tailored to the individual. I mean, a lawyer's path to recovery is going to look totally different from a construction worker's, right? So smaller, more focused settings where that kind of customized care can happen, well, they just get better results. It's that simple.
And really, at the end of the day, this is what it's all about. This quote, "Help me believe in the woman I could become." That just says everything. The right kind of support isn't just about stopping a behavior. It's about helping someone see their own potential again, helping them believe in a future they thought was lost. So if there's one thing to take away from all this, it's this. We have to look deeper. We have to understand the unique, often invisible pressures that people are facing because of their job or their life situation. That understanding, that's the absolute first step to actually helping them.
And that leaves us with one last question to think about. Now that you know all this, take a second to think about the people in your own life. Your coworkers, your friends, your family. Who do you know that might be silently struggling under the weight of pressures you never even considered?